Hello, good morning to all of you. Today we will discuss something about acute respiratory infections in children. Acute respiratory infections are a major cause of morbidity and mortality in young children world over. Nearly 4 million children die every year due to ARI, and ARI accounts for 30 to 40% of hospital visits by children in the office practice. Most young children worldwide have 4 to 8 episodes of respiratory infection per year, and the incidence of acute lower respiratory infection, that is pneumonias, is very high in developing countries. What is pneumonia, or what is acute respiratory infection? ARI comprises of infection in any part of the respiratory system, upper or lower, lasting for less than 30 days. For otitis it is less than 2 weeks. So the acute respiratory infection can be divided into two groups. One is anatomical classification, the other is the clinical classification. The anatomical classification depends on whether the upper respiratory tract is involved or the lower respiratory tract. The demarcation is at the level of glottis. Any respiratory airways above glottis is upper respiratory tract, and below glottis it is lower respiratory tract. What is the significance of this anatomical classification? What is the significance of this anatomical classification? Whereas in case of upper respiratory tract infection, it can be a medical emergency, like if there is a foreign body or epiglottitis, acute laryngitis. These are all may result in narrowing of the airways, thus making the airways critical, and the child may result in acute respiratory distress. Whereas the lower respiratory tract, the infections which spread below the glottis can be because of various factors like acute tracheolaryngobronchitis, acute bronchiolitis, or acute bronchopneumonia, or acute pneumonias. So now, having said the various aspects of clinical classification, we go to the etiological factors. See, the etiological factors depend on the age of the patient. 0 to 3 months, usually the maternal passages, the maternal delivery passages, or the organisms which are responsible for the pneumonias in children, in infants less than 3 months. They are gram-negative organisms, group B streptococci, chlamydia, streptococcus pyogenes, and various viruses. And those infants more than 3 months up to 5 years, they may be affected by the commonest organism being streptococcus pneumoniae, H. influenzae, viruses, and staphylococcus, in that order. It is not only the etiological factors. It all depends on the immunity of the patient, age of the patient, immunity of the patient, and so as the age, lesser the age, lesser is the more is the chances of infection. The second is it is related to malnutrition. Malnutrition is the commonest acquired immunodeficiency. So it is a vicious cycle. What happens is a child who is malnourished is susceptible for infection. The infection in turn results in malnutrition. Malnutrition again results in infection. Unless we intervene in this cycle of malnutrition and infection, the prognosis of the child is very poor. The other factors are, if the contributory factors, if the baby is not breastfed, and if the baby has got vitamin A deficiency, as it occurs in most of the children who are recovering from measles, low socioeconomic strata, poor hygiene, and if the updating of the vaccination is not proper, these are all the children who are more susceptible for ERI. Now, we have identified the etiology We have found out the comorbid conditions. Now we'll go to find out how is this infection transmitted. See, there primarily it is transmitted by either aerosol or droplet. What is the difference between aerosol and droplet? Aerosol is the small particles which are suspended in the air and they are transmitted directly from the infected patient to the airways of the recipient. Whereas a droplet is a virus is surrounded by some amount of the secretion of the patient and it goes and settles down on the surrounding unless the patient is in very close contact, let's say about 1 or 2 meters, they will invariably land in fomites like the tables, pens, and various other objects, and wherein by touching and subsequent putting the finger in the mouth, nose, or eyes, they are transmitted to the respiratory tract. So we got two things like in the present corona infection, it is basically by droplet infection. It is not aerosol because even though the virus size is 100 micrometers, nanometers, it is not one virus. It is 3 to 4 viruses joined together and they are enveloped in the secretions of the patient. So the total droplet which is formed comprises of 3 viruses, virus particles, plus the secretion, and that makes it very heavy. So it cannot be transmitted by aerosol. It tends to settle down on the fomites. So that's why we have to take precaution of sanitization of hand and covering the respiratory tracts. So now having said that, our endeavor should to treat. The whole aim is to early diagnosis and intervention. And if you diagnose a child with pneumonia at a tertiary healthcare center, it's of no use because only selected people can afford the tertiary care. And secondly, it will be too late by the time it is come to the tertiary level. So the whole exercise is to classify these pneumonias, how we can intervene at a community level. For that, WHO has classified them into pneumonia, severe pneumonia, very severe pneumonia, and no pneumonia. Now, before going to this classification, we have to know, because in one of the classifications, one of the where you decide between no pneumonia and pneumonia is the respiratory rate. It's a critical factor. If for that we have to delineate what are the children, what is the respiratory rate corresponding to the age of the child. So for that, WHO has said children or the infants less than 2 months, respiratory rate of more than 60 is significant, like tachypnea. And from children between 2 months to 12 months, it is 50. And all those children above 12 months, the respiratory rate of 40 is significant. So below 2 months, 60, 2 months to 12 months, 50, and more than 12 months, 40. So now having defined what is tachypnea, we'll go ahead and see how we can categorize these patients into various severity of pneumonias. So for this, what you have to do is you have to take a cohort, that is a group of children who have got respiratory symptoms in the form of fever and cough. These are the two cardinal features or two cardinal clinical symptoms based on which they are either included or excluded from the respiratory infection control. Suppose if a child has got fever and cough, so he is included in the T. From this, again we subdivide. If the child has got fever and cough and increased breathing, that is, he's got tachypnea, he's got increased chest movements, then he's supposed to he has had pneumonia. Okay. But if he does not have tachypnea, he only has got cough and fever, that means he has got upper respiratory infection, right? So we have classified upper respiratory infection and pneumonia. Now we go to the second, what is severe pneumonia? A child has got cough, a fever, a tachypnea. In addition, he also has got retractions. Retractions is the body's response to hypoxia. So it is a sign of increased stress on the respiratory system, which may result in acute respiratory failure.